Acute Coryza is the next discussion that we'll be having on our YouTube channel. So we'll talk about acute coryza, and we get to see that this acute coryza is also known as what? Common cold. Okay, so acute coryza is also known as common cold. So we'll talk about this condition, and we'll talk about it under the following headings. We'll be talking about the characteristics, we'll be talking about the causes. Okay, then we'll be talking about the symptoms, the diagnosis, treatment, and if left untreated, what could be the complication. Then the golden talk will be on the prevention. How can you be able to avoid this word acute coryza, which is a problem that will be affecting the nose, right? So, acute coryza, let's move. We said that this acute coryza is also known as what? Common cold. All right. It is a viral infection that affects the upper respiratory tract. And let's talk about the characteristics now. It is characterized by what? Can I say the person is trying to blow the nose because there's like something that is blocking the nose. Okay. But probably the thing might not be there. Okay. There's just that feeling. So there's nasal congestion. Then when you blow your nose, the thing will be watery. That's a runny nose. Okay. There'll be sneezing. Sneezing like hell. Okay. There'll be coughing. Okay. Then the person will having sore throat. There'll be headaches and there'll be fatigue. That's like general weakness. You might even feel some malaise, like generally just feel like you are sick. Okay, causes. What could make your nose behave like this? Definitely, most of the times it is what? Infections. Okay, and these infections, stubborn infections like this, are from viruses. Okay, like rhinovirus, coronavirus, adenovirus. Okay, then also if you are exposed to some allergens or irritants, there's that problem. Then if there's a weakened immune system, there's also that problem. Then talking about the symptoms, like symptoms onset, you start, the characteristics are the symptoms, right? So here we are just talking about how the symptoms will start. Okay, onset is if you are exposed to any of the allergens or viruses like we listed, between 2 to 14 days, you must be down with this. Okay, because those guys are not there to play, they are there for business, right? Duration is what? 7 to 10 days. Then peak severity is within the 3 to 5 days. Sometimes if you notice, if you have any cough and catarrh, there's when the two will be very high, they will start declining. That's what we are talking about. Diagnosis, medical history, physical examination, the rapid antigen dictation test. Okay. Treatment. You might just advise the patient to rest and hydrate themselves. Since they are losing water through runny nose and all that, ask them to drink more. Okay, till the virus gets tired. Okay, then over the counter medications can also work, like what? Pain relievers like what? Acetaminophen, then acetaminophen. Okay, then decongestants, expectorants, saline nasal sprays, and humidifiers can also be of use. Okay, so this condition now, which is acute coryza, if you leave this condition untreated, it can result to other severe things like what? Sinusitis, ear infections, bronchitis, pneumonia, that's in severe cases. Then they can also be what? Exacerbation of the underlying conditions. That's if it is anything, any disease condition underlying that is causing it, then you leave it like that. Then the disease condition will be growing more. Okay, so that's it. Then prevention. Since the bulk of the infection is from, since the bulk of the causes is from infection, you might just want to practice a good hygiene to be on the safe side, like hand washing, then avoid close contact with people who are affected by this. Then also avoid sharing utensils or personal items. Then stay hydrated during the condition, right? So that you don't lose too much fluid and you are generally weak and all that. Then also manage your stress. Then consider vaccination, like vaccination for flu or any vaccination for viral infections. All right. So that's it about acute coryza, also known as what? Common cold. Characteristics, causes, symptoms, diagnosis, and down the line.